Are you wondering if Ozempic or Wegovy works for weight loss? I can tell you it absolutely does, but you'll gain the weight right back when you stop, unless you dramatically change your lifestyle. There are so many costs when it comes to these prescription medications. Never mind that these drugs cost about $4,000 a month per person, which could supply several families their monthly grocery bills. Putting the money costs aside, there are also health costs. When you get the prescription, it will come with a black box insert warning you by the FDA that there is a risk of potentially getting thyroid cancers. And you'll notice that they have the same warning in both brands. And this is because it's the same drug. It's really a sales technique. You know, once I met a person selling organic bug spray, and literally he had 3 cans, one label for ants, spiders, and an all-purpose bug spray. But they were the same ingredients in every single can. And I asked him, why would you have 3 cans with the same ingredients? And he replied, consumers like different packaging. So don't be fooled by prescription marketing. They are chemicals, just like bug spray, designed to change your metabolism and your hormones. I prescribe these prescription medications too, and as a physician, I understand that there will be side effects. So the risks have to be so low and the benefits have to be so high that it is worth me prescribing it and giving to my patients. For me to personally take medicines or to give my children medicines, there has to be no other safer way to achieve the same goal. Lots of chemicals have proven to help people lose weight, like fen-phen, ephedra, DMAA, and Belvic. But they all came with healthcare costs. Fen-phen destroyed heart valves at about 6 months. Ephedra takes about 4 years to cause heart attacks and strokes. DMAA increased heart attacks and strokes in a dose-dependent manner, and Belvic increased cancers discovered at about 5 years. This is a problem when we focus on weight as a marker of health. Bad weight is one symptom of bad metabolism, but it is not a reliable indicator of your health. May I remind you that we have lost young people who have died young being normal weight. Ozempic and Wegovy are so popular that they are now designer celebrity drugs, kind of like anabolic steroids. They're used for a quick fix for vanity. Unfortunately, when you mess with your metabolism, whether you're eating bad food or not eating food at all, or loading up on prescription medications or herbal medications, you may be jeopardizing your health. And this is because good metabolism is essential for every single cell in your body. We can't predict how you will react to these drugs. If you are on a newer drug, you're literally a human experiment collecting data for us. This is called post-marketing reports. When you starve your body, you will burn fat and you'll burn it everywhere. And so this is why people have Ozempic cheek face, right? Because you're reducing fat in your cheek. Then this naturally happens actually in normal people who starve and who are aging. But obviously, this is not the vanity look that people are going for. But you can't fix it except with plastic surgery. But if the benefits outweigh the risks, meaning you have some kind of disease from your fat so severe that you have to take biological agents to change your metabolism and your hormones, then this may be worth the potential side effects. It's like getting cancer. I'm gonna do cancer chemotherapy. I'd rather do that than take my chances. But if there is a side effect-free option, wouldn't you rather do that instead? The thing is, side effects may be silent and slow and may not show symptoms for quite a while. And that's why you can eat donuts for several decades before you get fatty liver and then get diabetes and then the complications of diabetes. And hence there are many different ways to achieve weight loss, and each comes with unique side effects that may take a while to present. You know anybody with a gastric bypass? Gastric bypass patients achieve great weight loss at the expense of infectious complications, low blood sugar, chronic diarrhea, malnutrition with deficiencies in vitamins and minerals and other micronutrients that require lifelong supplementation. And when it comes to supplements, you would probably tremendously benefit from micronutrient supplementation too, except no one has taught you how to do it. If you're on a ketogenic diet, you're gonna need more selenium, magnesium, potassium, B vitamins, vitamin C, vitamin D, and thousands of micronutrients only found in plants. A person on a prolonged fasting diet would need 44 essential vitamins and minerals, 9 essential amino acids, along with the thousands of phytonutrients that you find in plants. And if you are on a low-carb diet or a high-carb junk food diet or the standard American diet, you will need supplemental micronutrients too. Even vegans and vegetarians need supplemental micronutrients, such as zinc, vitamin D, vitamin B12, and iodine, unless they are calculating their food intake and purposely seeking those nutrients. And it's really hard to do well. I can't even do it. The data is clear. We live in a micronutrient deficient food world. The stressors you have will dictate how much micronutrients you need. Remember, a micronutrient is a supplement only if you're getting enough of it. If you're deficient, it's essential for you. My dad died because of a spinal fracture from sitting on a toilet. His spinal surgeon told me his bone was super soft, that a rod that he put in may not hold. He had adult onset rickets or osteomalacia because his vitamin D level was 0, unmeasurable. It's unbelievable. His physicians, none of them checked his vitamin D level before he fractured his spine. At that time, I was a really young physician and I didn't know any better. He should have been on vitamin D supplements. I should have actually been monitoring his health visits and helping him to target optimal vitamin D levels to prevent bone loss, immune and respiratory complications. That's a level of at least 50, preferably closer to 80 nanomoles per liter. Vitamin D controls thousands of genes in your body. If you don't have enough vitamin D, you're gonna get in deep trouble. And like I said, a supplement is only a supplement if you're not deficient. There are 44 essential vitamins and minerals. How many have you had measured? I bet less than a handful, because many of these we can't measure reliably. Unfortunately, the common medical practice is to wait for signs and symptoms like a fracture before intervention. That is really too late for millions of people, including my dad. I am very concerned about using Ozempic and Wegovy for your health. It works by shutting off your appetite. Your body weight is not an accurate reflection of your health and inflammation. We know these drugs will fail when you get off. I know people who don't want to get off because they tried it and they gained the weight right back. And this is because the root problem was never addressed. It's not addressed with a shot. You don't cure an addiction with a shot. It's your food quality. You have to eat. Honestly, I would rather have supplied groceries for people for $4,000 a month than take a drug that's not addressing, even close to addressing the root cause. Learning to eat whole quality food has been proven to reduce weight, cure metabolic diseases such as diabetes type 2, high blood pressure, reduce cancers, reduce infectious diseases, and Ozempic and Wegovy actually can increase your risk of cancer, increase your risk of infections. And when you restrict or fast from eating micronutrients, including whole food fiber, you're sacrificing your health, your gut microbiome, the trillions of friends who will either make you inflamed or reduce inflammation. And the good guys only eat fiber. I see this as a recipe for health disaster. These drugs are like any new fad diet. It's new, it's novel, and the side effects will be new and novel, and you'll continue it until the side effects are not tolerable. Really, all drugs work like this. We don't stop drugs until the risk outweighs the benefit. And food works like this because you will continue to eat what you eat with the chemicals in your food that changes your hormones and metabolism until you can't stand it. It increases a whole host of other problems, including fat as a metabolically organ that irritates your liver, suppresses your immune system, and causes chronic inflammation, leading to chronic diseases such as heart disease, high blood pressure, fatty liver, obstructive sleep apnea, diabetes, cancers, infections, arthritis, amongst many other problems. And if you're suffering from any of those diseases, these complications of excessively metabolically active fat, maybe it's worth it for you to use Ozempic and Wegovy to jumpstart your health. So as long as you're using prescriptions to bridge your health, and it's not a way of life, that there's a way out, and you keep the medicines at its shortest possible course, then your body will be resilient and will be able to recover from the unwanted side effects caused by the medicines. And you will achieve success in gaining your health, reducing inflammation, and achieving longevity. Join me in my next video to learn more about optimizing your health.